as scientists try to keep ahead of new COVID-19 variants, getting South Africans with underlying conditions, aka comorbidities, vaccinated becomes increasingly critical. Yet vaccine hesitancy still is an issue in some parts. To find out why this is, we're joined by the General Manager at the AfroCentric Group, Dr. Samukeliso Dube. Dr. Dube, a very good evening to you. Thank you for being on News at Prime. So let's begin with some of the research you've been doing on vaccination trends in the country and what it is that's jumped out at you as far as trends so far.
So we are on course in trying to galvanize South Africans to vaccinate so that I think for us, want to try and avoid the fourth wave, but want to just do the right thing given the crisis that we face and where the country is going. And, you know, we are heading towards the festive season. We do want people to vaccinate. So we are on course in trying to get that. But we know that there have been delays in people getting to vaccinate. And that is what we call vaccination hesitancy. You know, the delay in acceptance or refusal of vaccines despite availability of these vaccine services. That's what we are facing in the country, and that's why we still sit at way below, like around 30% compared to the global average, where half of the populations have been vaccinated.
And who, from your observations, is most hesitant?
So it's people from all groups of life. I wouldn't cluster people and say you've got this type of population versus this population, but largely people have been hesitating going for vaccination for religious reasons, some for cultural reasons, but some is just sheer ignorance because they do associate the vaccine in their minds with something that maybe happened to their neighbor or something that they heard from social media, etc. Right now, it's actually right across the board. But I must say that we are seeing lots of vaccination hesitancy, especially in the townships, in the rural areas. That's where actually most of this is happening.
And just on that then, how accessible is not only vaccine doses, but actual information about the vaccines themselves, how they behave in different categories of people, the young, the old, those with comorbidities?
Certainly, I think the there's been information galore globally, but also in South Africa. I don't think we can say there is a South African who hasn't heard about the benefits of vaccination. There isn't a South African who hasn't heard about what COVID-19 would do, and that the benefits now, they do reduce the rate of hospitalization and also they reduce death. So that's what we are trying to do. Information has been available through the National Department of Health, communication and the campaigns that have been run by NGOs, civil society, and people in wards and in communities. I think information is available. But what counters that information, what leads to vaccination hesitancy, particularly the information that we get from WhatsApp, information that is from the pulpit, or information that is from people who are trusted members of communities. This is where the sources of vaccination hesitancy actually emanate from.
I wonder then, Doctor, if perhaps in the government and corporate strategy on communications around the vaccines, there isn't a need at this stage for a change perhaps in tone and the language itself in order to make it or to allow people at least be more receptive to what's being said.
Yes, ideally, that's where we would hit the mark, isn't it? And we know that anything that has to do with people changing behavior in one way or the other, whether it's about you eating healthy, whether it's about you waking up to stretch and run, it's not very easy for people to sort of partake. So I think there is need for evidence-based communication strategies because right now we know that some people have been using a stick without a carrot. So we need to actually approach this both ways and encourage people to vaccinate. And now that we are opening up the vaccination story to wider than those who are above 18, we do hope that the message which will actually land better in homes and in families.
There is some nervousness in the medical and scientific space about the upcoming local government elections, the campaigning ahead of that, which has seen crowds gathering, sometimes not wearing masks. You've got our vaccination rates that are still quite low. How nervous are you about the potential of another wave, the fourth wave, which some are saying could in fact be just weeks away?
So we do hope that even the figures that we have currently, although they are still low, we haven't hit our 70% mark. We do hope that it would avert a fourth wave, because when you vaccinate to a certain level, you prevent onward transmission, and we do hope that what has happened would prevent that. But that is to say that actually, matrix writing, some are thinking of rage parties, people are thinking of gatherings around elections. That is something that we want to avoid, because we are not yet out of the gutters, Tembegile, and we do need people to take caution, especially to wear masks and to continue to sanitize, because this epidemic is still with us.
Dr. Samukeliso Dube, General Manager at the AfroCentric Group. Good to speak to you tonight, ma'am. Enjoy the rest of your evening.